So whenever you're ready, we'll do a couple practice breaths, and then a deep one, and hold it. Good. Great job. And let it out.
Deep inspiration breath hold is basically a way of saying, take a deep breath and hold it. It's a technique we use here at Rush to protect the heart from radiation therapy in women getting radiation therapy for left breast cancer. When we take a deep breath, the lungs expand, the diaphragm goes down, and that pulls the heart away from the left breast. In that way, we can deliver radiation therapy to the left breast, but give less dose to the heart. Most patients are anxious about going through radiation therapy in general, and our job is to explain the procedure and how safe it can be and what an important role the patient can play in going through the treatments. We're very good at coaching our patients through this procedure, teaching them how to do it, and all the patients we've treated thus far have been able to complete the treatments successfully. Radiation therapy for each patient is custom designed for that individual. Each patient undergoing radiation therapy first undergoes a CT scan of the part of the body that is to be treated, because everyone's anatomy is different, and we need to determine first how that individual's anatomy aligns with the area we want to treat. First, the patient practices breathing with one of our staff therapists. A box is placed on the patient's lower chest area, and that is tracked using an infrared camera. Tracking that device produces a yellow bar on the monitor, which the patient can see. When she takes the full deep inspiration, that bar moves into the safe zone and turns green. That allows us to know that the full deep inspiration breath hold has been taken, and it's safe to deliver the radiation therapy. It takes only about 25 seconds, and that allows us to determine when the treatment should be delivered. It's important for the patient to realize that she's in complete control of the procedure, and if the patient coughs or is unable to hold her breath, the radiation would stop immediately.
And let it out.
After that's been accomplished, the CT scan is done while the patient's normally breathing in and out. After that scan has been done, we perform a second CT scan of the chest while she's in full deep inspiration breath hold. It's usually very easy to do after the coaching. What these scans demonstrate is that with free breathing, we can sometimes encompass part of the heart with our radiation beams. With deep inspiration breath hold, our radiation beams avoid the heart entirely. This bar graph shows a comparison of the radiation dose delivered to the various heart structures using conventional free breathing techniques versus the voluntary deep inspiration breath hold technique. What you can see is that all heart structures, the ventricle, the heart, and most importantly, the left descending artery, receive much less dose with deep inspiration breath hold technique compared to the free breathing technique. The patient then begins radiation therapy, usually about a week after the CT scan is done. She's taken into the treatment room and does several practice sessions again on the deep inspiration breath hold technique using the monitoring device. After the patient's comfortable with the practice, she would receive her first treatment.
Okay, whenever you're ready, we'll do those 2 medium breaths and the deep one and hold it.
We've implemented the deep inspiration breath hold technique here at Rush, and we want you to know that it makes your treatments as safe as possible.